American Medical Response, we're one of the largest emergency medical services providers in the United States. We do non-emergency ambulance transportation, 911 response, air ambulances, a tremendous amount of managed transportation across the U.S., and a big piece now is the mobile integrated healthcare and on-site medicine. And we do that sometimes on oil platforms, patients' homes, all across the U.S. Wherever the patients are, we want to be able to have service to deliver it. The position of American Medical Response is to provide everything we need so that paramedic can provide the best possible care, one patient at a time, and all the infrastructure is there to support them. As healthcare changes, that's our job, is to make sure that we're building an organization that can change with it. It's all about that individual caregiver, it's all about that individual patient contact, and it's all about making sure that what we do is in a coordinated approach with that community.
Using the skill set that EMS has developed over the years, the ability to get to wherever patients are, the ability to manage them outside of the home, the logistics, the trust, the built-in trust. Now we use that on the other end of the spectrum because we can get to them. We can get to them on Sundays. We can get to them at any time, and we can communicate with their healthcare providers.
Well, American Medical Response is only one piece of the triad. It's part of Envision Healthcare, which is also MCare Physician Services, which provides everything from radiology to anesthesiology to emergency room physicians, and then also Evolution Health, which provides caregivers to homes, be it physician assistants, nurses, and other caregivers.
This is the Williams Medical Command Center, and if you think about marrying two key concepts in medicine, so a practice of medicine with the logistics of a 911 and communication center, that's what Evolution Health does, taking the expertise of very strong clinicians and making it available to patients through the logistics and the network of a 911-like system.
Our relationship with our fire partners is critical to success for that patient. Fire first response, being there in that 3 to 4 minutes after advanced life support need is requested, and then having a partner like us be able to be reliable and be there to provide either the transportation or other advanced life support. It's a critical function that we have to have with our fire partners.
The reason behind us partnering with AMR Ambulance was twofold, really. First of all, they've been doing business in the county for about 30 years, and they're well respected. They knew how to provide ambulance service in the county efficiently. And the second reason was they were part of a larger healthcare system that was a visionary system that would, I think, position us to better adapt to the changing economy and healthcare reform. Throughout my 30 years in this business, we've sent fire engines and we've sent ambulances, but we really haven't integrated those two into one specific system. They've always been two separate businesses. So with this innovation, now with this new model, we'll be able to use the resources from ambulances to fire engines to fire trucks to specialty resources, and we'll be able to send the right resource to the right incident.
AMR has mobile integrated healthcare across the nation, but locally here in Arlington, our mobile integrated healthcare is a joint partnership between AMR and the Arlington Fire Department. What we learned was that these programs are very scalable. They can really be set and developed to meet the community needs in the local health community.
Within the last year, we've developed a partnership on the community health paramedic program, which we work together on to serve the individual needs of citizens in Arlington with what we've identified as healthcare gap coverages. We have different firefighters and paramedics from AMR working together. They can build more than just a working relationship. They can build friendships, call someone by name on a scene, and that's very important to the seamless transition of patient care from our first responder program to AMR's medics, who will then transport them to the hospital.
I think it's a fantastic program. It actually brings the healthcare from the physician level out to the patient's house. Makes it to where they can have a good assessment, they can have good information, they can get their medications, and then there can be a report back to the physician itself.
Everyone we've talked to has been completely for the program. When we explain it to them, explain the outcomes we've had with some of the patients, they're blown away by it. They think it's a great thing, and a lot of them start asking us if we can start seeing their mother or father.
It's just a building effect. You know, we care for these people. Genuinely, they are like an extension of our own family. So we want what's best for them, just like we would for our own sons or daughters or mothers.
It's really easy to talk about how valuable it is to be collaborative and to be partners. And then something very real strikes us, or we're presented with it, and it illustrates how important it is to walk that walk. In our case, Ebola was a prime example of something that required collaboration. It required all of us to work together to solve a problem that every component had some degree of expertise in, but nobody had the entire package. We've talked in medicine a lot about what the future could look like, that there'd be mobile integrated healthcare. Imagine physicians and nurses and advanced practice nurses and medics and EMTs working together in a non-emergent fashion. It's here.
American Medical Response is just so excited because it's something that we've been talking about, working with our communities, but now we're crossing that bridge and now we're time for implementation. So mobile integrated healthcare is coming to communities across the U.S. Our ability to partner with fire departments and local communities, the time is now. We're just very excited about that.